So we will go. Okay, please state your name, title, and company affiliation.
Hi, my name is Jody Terakawa. I work for a company called CubeChain, and we create custom blockchain solutions for many of the customers, including those in the healthcare space.
So can you talk a little bit about your background in blockchain and healthcare and kind of what has brought you to where you are today?
Well, what kind of brought me over into this space is really, actually, I spent about 13 years as a senior operator at several FI companies. And the last one I was with, you saw about the product and services is quickly becoming a commoditized product. It's very just pure transactional basis where everyone's producing the same thing. So when I was introduced to blockchain, I thought, well, I mean, this is an opportunity to actually do something different. Originally, I was looking at some ideas and some, concepts that would apply to the B2B space, and still pursuing those more on as a side part of it, as we've been more focused on really developing some new innovative products for healthcare. We have what we call the Cube Vault, which allows us to capture medical records and store them in a secure way, providing the access to the consumer and not retain access for ourselves or any bigger enterprise. It's really trying to empower the consumer to control their own information. We also we're working closely with a company called Anthem, and though it's a little bit early to talk about what we're doing with them today, I can kind of talk about maybe some of the challenges that blockchain will have as we try to continue to push these type of products, especially in the healthcare space. And I would say there's two things primarily. Regulations is a huge thing, right? When you're trying to push anything new and innovative into anything touching insurance, the amount of regulations that you have to go through and overcome is pretty daunting. For someone that came from the financial services space, I was used to some level of that. I was actually in charge of compliance for in the merchant services business for a while, so I'm kind of familiar with regulations. But what I'm seeing in the healthcare space is much more complex. There's a lot more different angles in which they're trying to regulate and keep control of that product, and they're really not. And the fact is that when we would pass and try to push product on the financial services side, mainly dealing with more of a federal mandates and laws, certain products might have touched the states, but most states didn't really care. In the healthcare space, the bigger challenge is if you're trying to roll anything big and new, you're not only just worrying about some of the federal requirements, which are probably a little bit easier, it's really dealing with the 50 different type of regulators that you're going to hit with every state you want to try to roll this thing out to on a national scale. And so I think over time, it's going to force companies to kind of dumb down their product a little bit and not be as forward, because if you want to roll out a national program, you almost have to take it back, a couple evolutionary steps and progress and go at a slower pace to prove yourselves to the regulators. So, do I think it's something worth doing? Absolutely. But do I think that the roadmap is going to be short? No, it's going to be a long roadmap. We're going to have to test that certain states are a little bit more, liberal about some of their rules, not loose, but at least more open to new ideas, and just prove the value. Because once you prove the value and how the impact that blockchain can have on a company in healthcare, driving down expense, then being able to sell that case to other states or regulators and politicians that manage that kind of, dictate some of the regulations, it's going to be a much easier sell. So that was probably a long answer to a short question. But
No, that's awesome. Good. And actually, let's pause really